Hello, everyone. Welcome to our special office hours to talk about the Continued Eligibility for Services tool, the CESS tool. Wanted to thank everybody for joining us today. We are going to walk through a policy change that came through with this and have time for questions and discussion throughout and at the end. We are recording this session as we normally do for an office hours, and that will be up on our website for a resource moving forward. And that should be coming up soon. But we'll get going and just get a jump on here. So this particular tool is coming through a policy change that we just put forth, which I'll be sending out to the network after this meeting. And this tool, letting in a couple people as I'm talking, it's always a fun thing to do. This tool is taking the place of our policy, which is a qualifying conditions policy in the past. Since we've incorporated the CESS tool and appropriateness criteria changes, this policy has been renamed the Eligibility and Appropriateness Criteria Policy. So we just wanted to note that for folks right away. You'll notice that those changes are in there and you'll be able to view them as you're moving forward. As everybody knows at this point, or should know, effective November 1st of this year, the CESS tool was incorporated throughout New York State through the Department of Health, Health Home, for CMAs to institute for all members that are enrolled that are adult for the network. And we are looking at talking through that today. So specific to adults only, as we had mentioned. And it's going to really focus on those members that are Medicaid and actively enrolled and meet the eligibility requirements. So what does that mean? We'll talk through that today. And then the other thing is that this has to be completed annually to coincide with the comprehensive assessment. We want to make sure that folks are aware of that as we move forward, that the comp assessment, when that due date is there, that is when this tool should be coinciding with. So we will start going further through that. And the tool is located in the additional forms section through NetSmart Care Manager, as many of you know at this point. And we are not allowing paper version of the tool moving forward since it is electronically available through NetSmart Care Manager. So just so folks are aware of that, we want folks using NetSmart to complete the tool. The tool does not replace the requirement to disenroll members organically, if you will. So if folks are ready for graduation based on their circumstances and you've worked with them and they've gotten their point in life where they're not needing health home care management, you would follow the process for disenrollment as you normally would. It's not required to be completed before a disenrollment occurs. So we should not be doing it just to move towards disenrollment. If we have organically scenarios where people are going to disenroll based on accomplishments with health home. And then I just wanted to note that the CESS tool does not have to have the criteria met before a person graduates either. So just wanted to be real clear about that. So we want to make sure those defined timeframes that we'll be talking about today are met for the tool to ensure eligibility and appropriateness, but the tool does not have to be completed in order for someone to graduate for the program. Now, if a person is Health Home Plus eligible, DOH has said that the tool does not have to be completed, but there's an option on the tool itself to identify whether someone is Health Home Plus SMI, Health Home Plus HIV or AOT, and that would be selected, and then you can't go any further in the tool and once you've saved it. We would like to ask to make sure that folks are following that process. If someone is Health Home Plus HIV or AOT, that you go in, you've completed that question in the tool, save, you're done at that point, because that's going to allow us to track that through the health home, through the data that we have to actually report out to DOH monthly moving forward. So We are asking folks, even though you don't have to go through the whole tool because it won't allow you to do that, but we still have to go in and identify that that person is, in fact, Health Home Plus eligible. Um, the next thing would be if the person is a Health Home Plus and they're moving into step down, the tool is going to be 12 months from the date of the step down, regardless of the comprehensive assessment due date. So when someone is going into step down from Health and Plus to step down, it's going to be 12 months from the date of step down. So ultimately, at the bottom of the slide, the procedure we just outlined as we were discussing, it's not going to include pending members at the time of the annual comprehensive assessment. So we want to make sure that that tool is completed for the enrolled member at the time of the assessment itself. If they're pended, that's going to be changing the circumstances a little bit, which we'll talk about in a little bit in our deck today for presentation. And then once that tool is completed and continued enrollment is recommended, that person's going to have every 6 months thereafter to have a new tool completed. I just wanted to pause if there was any questions before we move forward to the next slide. Okay, so we'll move forward. Jessica, you're on.
She can't talk.
She
No one
can't
can
talk.
hear.
Jessica, no one can hear Jessica? All right. Well, Jessica will continue to listen. I'll keep talking. So we're going to talk about the outcomes of the CESS tool. Can folks still hear me?
I can.
Okay, good. All right. Just want to make sure.
At least me.
All
I
right,
can
so
too.
the eligibility.
Karen Fid said she can.
Okay, great. Thank you, Karen. It's good to hear it's someone outside of HI staff that can hear. So the CESS tool outcomes, that's the next thing that we want to talk about. So for continued enrollment outcome, if it's determined that the person's going to continue with the program, then it's going to be a reassessment every 6 months thereafter. So the risk factors that contributed to the recommendation should be incorporated to the plan of care for Health Home if they're not already incorporated. So we want to make sure that those risk factors are incorporated into that plan. I apologize again, people are still coming on and I have to manually let them get on, so it's a little distracting still. If the determination should be shared with the member, so again, if it's incorporated in the plan of care, that determination should be shared with the member and be part of that care plan development for them moving forward. And then you will have to complete the tool again at the next 6 month mark. So once the tool is completed, they continue, it's going to be another 6 months, and then you would do the tool again. If you get to the category of disenrollment and it's determined that that person needs to be disenrolled from Health Home, there's a 60-day window to have that happen, and there should be a graduation discussion and planning around that as much as possible towards a warm handoff, etc. Step down to another level of care. So maybe it's through the MCO care management. Whatever's applicable that would be appropriate for that person. And we're asking folks to continue to follow the Health Home disenrollment policy to ensure that the process is followed as policy indicates. The outcome should always be reviewed with the member and the team as appropriate. And then if they're not in agreement, then we should be issuing the 5235. And then due process would go forward in that respect. But we should be having that discussion. They should be aware of it. And we should be following policy for disenrollment if they're, and particularly not happy with that decision. If the member's not in agreement with their disenrollment, they'll complete that 5235. They're going to check the other box and note the reason which we would like to have stated as the members no longer engaged in health home care management services as defined by the CESS tool. So we really want folks to use that language so that we can indicate that through our reporting and also through any data reports that we're pulling to submit to the state or for data den purposes. I'm going to pause if there's any questions.
Travis,
Yes.
this is Sarah. Can we just go back to the screen that you had before? I just want to make sure that I'm putting the right procedures in place here. So at this point, you're saying that we should be doing this on everybody, even if they're Health Home Plus, but we would essentially just check a box if they're Health Home Plus. We wouldn't be doing the whole tool, but we still need to go in.
Correct. So we're asking for everyone to have to go in and answer that question. If someone's Health Home Plus, you're going to click that, identify it, save it, and you're done. Because we have to be able to track it for our data purposes. And it's also, as we get into Taylor's going to be discussing some reports that we're working on as a lead to provide through data den later on. And that's going to be accessible for the network. So in order to track that information, to get accurate reporting, we need to understand and then identify that through the system. So we're asking that folks go in, if somebody is Health Home Plus, Health Home Plus HIV or AOT, to check and indicate whether they are or not, and then save, and then you're done.
Okay, and what's the expectation on doing that? Are we going back to do that on people now, or would it be the same for when in 12 months or for
It
the
would
Health Home
be
Plus?
as long as they're Health Home Plus eligible and they're in the Health Home Plus status, they're going to continue to have that completed that way.
Right, so like right now, we would be doing it at their next annual assessment. So same thing for them as the other population that's not Health Home Plus. We don't have to do anything different.
If they're not Health Home Plus, you have to follow the tool every 6 months as indicated through the policy. If they are Health Home Plus, you're just going to indicate they're Health Home Plus and you're done until they're going into a step down category. Then that would change the circumstance where you would be
Travis,
doing 12 months from the step down. Yes.
I think what she's asking is should she go back and capture the people that are eligible for the tool that
Yes,
she hasn't done yet?
thank
Is
you.
that correct?
Yes.
I guess I'm not fully understanding. Eligible as of now or eligible as of November
So I
1st?
think the tool went into place as of what, November
November
1st?
1st.
So what she's asking is, does she have to go back and do the CESS tool for those people that were eligible as of November 1st? And the answer is yes.
Yeah, we want to go based on when this came into place. Again, the policy didn't come out from the state until the middle of November, and then the FAQ document's been updated a couple times since from the state. So we've had, a little bit of a time trying to get our policy put in place, but we have to go back to November 1 when this was all instituted, unfortunately.
So what
I wasn't quite understanding, Sarah, what your question was. I'm sorry.
So Sarah, what you could do is anyone who had a comprehensive assessment due in November, you could go back and do those tools now.
Okay, thank you.
Yeah. Was there any other questions around that?
Travis, can you hear me now?
It can,
Yes.
yes.
Hang on now.
It's a Christmas miracle. Oh, she's gone.
Any other questions that came up in the chat, Hannah? Because I can't see the chat right now.
Any questions that have come up, Jessica has answered.
I have a question. So the Health Home Plus population, we only do that at their annual assessment, correct? We don't have to go in and do that right now for all Health Home Plus people?
For those that are enrolled currently, it's when their next review is due. So the
Okay.
next annual assessment. And then it would be when they go into a step down situation eventually, then it would be 12 months from the date of that step down, regardless of the comp due date. Any other questions so far? Okay, we'll keep trudging on. So we started talking about the outcomes for the CESS tool, the continuing enrollment, the disenrollment piece. Any questions with that? I know that's where we paused before we went back a slide. Key thing here with disenrollment is just ensuring that we're putting that statement, members no longer engaged in health home care management as defined by the CESS tool. And then we're really recommending a transition goals being added to support that, you know, discharge moving over the next 60 days. And, you know, as that person's working toward the graduation, if, as folks have seen through FAQ and other discussions since this implementation happened November 1st, if there's a risk factor that presents in that 60-day time frame that may change that result, definitely consult with the supervisor and do another CESS tool. But that tool's got to be done within the 60-day window from the original tool. And you have to document that, and it's got to be in the record appropriately. And then the other thing that we want to make sure is that if they recommend disenrollment through the tool, that person, if they become appended through an excluded setting or diligent search, that the health home care managers continue to comply with the recommendation of disenrollment. And we'll talk a little bit further about the pended status as we get further in today's discussion. But you want to continue with your recommendation of disenrollment based on what the tool had, even if they are pended in that circumstance. And we'll clarify further. And then again, 60 days, that's the magic number. So we got questions coming in. I'll pause again.
The question was, will the 5235 be updated to note this when we disenroll? The 50, and Jessica said, no, the 5235 is not being updated by DOH. Please check other and write in CES tool disenrollment.
Yep.
And then the other question from Michelle was, is the CESS tool completed at the end of the 6 months of step down or when the start of the step down? So the CESS tool is, you would do the CESS tool a year after their step down. So they'll go into step down, they'll have 1 full year in the program, and then you would do the CESS tool. Does that make
Thank you.
sense?
Thank you, Hannah. Any other questions?
No, not in the chat.
Thank you. All right, so we'll keep moving on. If we hit the category of more information needed.
Can I just clarify something that Jessica put in the chat?
Sure.
So when someone goes into, I think there's confusion between the 6 months of step down and then the year for the CESS tool. So someone's going to go into step down for 6 months. And then you would take them out of step down and then a full year until you complete the tool.
Thank you, Hannah. Is
So
that
6
helpful?
months of step down, then a full year to complete the tool. So you don't have to worry about the CESS tool after the 6 months of step down ends. You have another 6 months and then you do it.
Right. Okay, thank you, Hannah. More information needed. If that determination is there, we want to make sure that the supervisor is working with the care manager to get that clarifying documentation. It's got to be completed again in the 60 days, the tool itself. If you've got more information that may change the circumstance, and you got to do a second that second recommendation. If the outcome comes back, more information is required, that's not going to be allowable. So ultimately, you're going to be moving toward a discharge at that point if it doesn't change the circumstance. Again, this information should be reviewed with the member, And we really want to try and collect any information to help support if that person's going to be disenrolled or continue to meet appropriateness criteria. So it's really a short window, but that's the time we have to operate as far as getting more supporting documentation. If you have unclear answers on the CESS, you can go set up a case conference with a provider, additional sources, psyches, etc., to get information. You can always reach out to the health home and we could try and brainstorm with you if you run into a circumstance where you really think the person possibly would actually be meeting continued eligibility, but you're not quite sure how you can grasp that information. We'll try and brainstorm with you as well. But the 60-day, that's the cutoff again. And the follow-up tool again is going to have to happen within 60 days of the first tool that was done. So it's a short window. Any questions around more information needed?
No, but can you hear me now? No, never mind.
We can hear
Yes.
you. It's just a little echoey.
Yeah, I don't know why or how to fix it.
It's
It's
not that
fine.
bad.
It's not. Just go. Just talk.
Wait, is that any better?
Yes,
Yeah.
we can hear you, Jessica.
I can, but I still hear an echo and I don't know why.
Okay. Well, I'll keep going then if you want to, because I don't want to disrupt the flow.
You're fine. I'm done trying.
All right, for pended members, so if someone's pended for an excluded setting and they missed their date for the CESS tool, so right, they're due for their CESS, but you can't do it because they're pended. The health home care manager should complete the tool within 30 days of re-engagement in the program. So once that person re-engages, you find out where they're at, they come back in. You have 30 days to get that tool completed. So if it happens this month, the tool's due, all of a sudden I'm DSC, you can't find me, I'm gone for 2 months, and then suddenly I resurface in that third month. You got 30 days from the date of myself resurfacing to get the tool completed and into the NetSmart Care Manager. So you don't complete it during the time when they're actually missing or not present or not engaged. So if the person's been enrolled under 12 months and has not had a tool completed, you're going to follow that original due date to complete the CESS tool. So I just wanted to pause to see if folks had questions around that. So we just want to make sure people understand if it's been under 12 months and a tool hasn't been completed yet, that the original due date would be followed if someone's in DSC. Okay. So now we want to look at if they had their initial completed and they have recommended due date for the next tool. You're going to reset to coincide with their updated re-engaged start date, right? So an example we can break out. So let's say a person enrolled on January 1 of 23, they're due for that tool on January 1 of 24, but they went into DSC in March of 23 and re-engaged at 24. You'd still complete the tool on 1/1 of 24. So it's not going to change that next due date in the 12-month time frame. But if you had a situation where a person enrolled January 1st and the annual CESS was supposed to be on the January 1st of 24, and there was a recommendation for continuing, the next tool would be due 6 months after. So it'd be 6 of 24. So that person goes into DSC in March of 24 to re-engage in May of 24. The new tool reassessment would be 6 months on the re-engagement status date, which would make it 11 of 24. Does that make sense for folks? Just want to pause if there was any questions. Hannah, were there any other questions that have come up?
The only
Jack?
other question was if we have a member whose step down ended this month and their annual assessment is due this month as well, do we complete the CESS tool this month, or hold off for another 6 months. The answer is hold off another 6 months and then do the CESS tool. So complete their annual assessment because it's due, wait 6 months, then do the CESS tool.
Thank you, Hannah. Anybody else have any other questions? Okay, we'll keep going. So what's the role of the supervisor through the CESS tool process? So the FAQ and policy through DOH says that it can be the supervisor or quality improvement staff to complete the tool, or there's an option for the care manager to do it as well. We're not going to dictate as a health home what your process is, as long as we have documentation in the record that the supervisors reviewed and confirmed the final outcome of the tool. So we just want to make sure that it's documented. Documentation always supports efforts. So it's up to you as an organization on how you want to work that out internally. You got to have the tool, have it in draft if you're going to have your supervisor finalize it and you want to do that route, or they can document it in the record through a contact note. So the supervisor can do that directly through a contact note that they reviewed the tool. And then any other concerns related to the tool. There is an ability for the supervisor based on DOH policy and FAQ to, I don't want to say override, but you can make a determination through discretion that a new tool can be completed in that same period for the first CESS tool if you don't think things were documented appropriately, or that maybe the information wasn't represented correctly. Maybe there's a relationship issue as far as the engagement with the member and the care manager, as far as status and what true needs are. So there's some circumstances that could allow a supervisor to override that initial determination and do another tool. And that's all got to be documented in the record as well. And it's got to happen within that 60-day time frame. Any questions on that piece? Okay. The third bullet here, we just want to make sure that folks know that we have to report. So that started actually, I think it's December of this month, that we actually have to start reporting through MAP. So that every lead has to report the tools outcomes to the state. There's not a billing component tied to it at this time. That could potentially change down the road, but at this time, there's not a billing component tied to the CESS tool itself. But we do have to report it, and we have to do it on a routine basis. Hannah, I just want to pause if there's any questions that come through chat.
Nope.
Nope.
Oh,
Okay.
Jessica just said on 12/16, the CES tool will start to report to MAP.
Thank you, Jess. I knew it was in December. So what's that?
2
What's
days.
today? 2 days. Yeah, it's coming.
Saturday.
Hi, sorry, I have a quick question on
Yeah.
that one back about the supervisor discretion. I guess this probably falls under there. So what if the circumstances change during that 60 days? Is that where you would maybe use that too? Like they were geared for disenrollment and then say, I don't know, maybe they become homeless or they have a hospitalization, something that could potentially change their situation.
Absolutely. Yep,
Okay.
absolutely. So if so the supervisor can have that discretion to do another tool if the determination doesn't seem as though it fits the mold, if you will. But again, you'd have to get all that required supporting documentation to really look to get that eligibility in play. But if a circumstance changes, like you just gave for an example, Jolene, someone's homeless, they've had a circumstance where they had an admission, to like a behavioral health facility or mental health facility. And it's really, and then they came back out and they've got they're in crisis mode, if you will. Those types of things would definitely constitute doing a new tool and getting that updated. It's just a matter of having the updated information to support that eligibility to continue in health home. Was that helpful?
Yes, thank you very much.
Yep. Any other questions around that? Okay. The health home will be, just so you know, as we start moving forward, as we get more information and data around the tool itself, we will be tracking, so through audits and whatnot, the tool and completion. And if there are a lot of circumstances where there's a big uptick on supervisor overturning the tools, we may look in and look into that just to make sure it's just not for the purposes of convenience, if you will, to have someone continue in the program. We want to make sure that there's a true need and that the eligibility is supportive of that. So we will be touching on that as we do our audits throughout the year, just so folks are aware as well. But we wanted to make sure that organization supervisors had the ability, when it's prudent to do so, to do another assessment if they felt that that wasn't determined appropriately in the beginning. Some examples I started to mention a little bit back, but if it's poor documentation, the person wasn't really understanding of the program, what the needs or what their needs fully were, and they weren't disclosed appropriately. It could be a care management agency or a care manager fit, or lack thereof, that may be something to look at that may better meet the person's needs. So really just getting a better sense of what are the circumstances that drove that decision toward moving toward disenrollment, and is there a way to, enhance that so that that person is eligible to continue. Got a document though. We just got to make sure we're thoroughly documenting, because that's going to tell the story. And you got that 60-day mark, which I keep saying over and over, but that is the crucial mark, is the 60 days for that to happen. And the other thing we want to just point out, that you can do a CESS tool at any point, at any time for a member. If circumstances change, you're working with a person for whatever reason, and you feel, let's do a tool, see if they're appropriate to continue in the program. It could also come from an outside entity out of your organization. It could be DOH requesting more information. Maybe it's the lead health home. It could be an MCO. There's other reasons that there may be a request for that tool to be completed. But just know internally in your organization that you could do that at any point. Any questions to this point? Hannah, did we have any in the chat?
Nope.
Okay. So just continuing ongoing eligibility and appropriateness, just health home serving adults again, that's tools focusing on that. It's going to assess the person at 12 months and then every 6 months thereafter. Got to use that tool for adults. We're asking again if it's someone who's Health Home Plus HIV or ALT, that you're at least going in and checking that box and saving, so that we can ensure that that's entered and categorized, so we can have the data on that. And we want to make sure that that person, if they have continued need for the program and they're still going, that their plan of care reflects things other than maintenance goals. We should not be doing maintenance goals. We just want to be careful of that, because that's going to get a situation where that person may end up leading toward a disenrollment. It shouldn't be based on maintenance goals for the person. And then the discussion, working around continuous discussion with the member if there is a graduation that's going to move forward with them, or a disenrollment for that matter. And then if a person's no longer appropriate, you're just going to work with them on that transition. And if there's a referral component, warm handoff as much as possible, that we're going to go ahead and work on that. One thing I'll note, just for folks out there the health home's well aware that there's not going to be happy people. The state's aware. The leads across the state have made it very clear that this new CESS tool is not going to make a number of people who are or have been receiving health home services that suddenly have 60 days and are going to be disenrolled. So that's going to have that ability to file a fair hearing, which is going to be a potential uptick, which hasn't been necessarily the case in the past for leads, where you get a lot of fair hearings coming through based on the disenrollment piece or not happy with how the disenrollment occurred. We, as a lead and other leads, have brought that information forward through the Health Home Coalition. DOH has actually acknowledged that they're our contact person through the DOH for our lead. It let us know that they're actually having discussions internally at DOH around Office for Disability Temporary Assistance when it comes to fair hearings and what that is going to look like and what kind of processes are going to be either changed or enhanced in that situation because of this outcome happening with people moving forward. So just wanted to put that out there for folks that this is an ongoing discussion. We have a desk guide that's in the policy, just as a quick reference for folks. Highlighted right here again, annual comp assessment due date. That's what you want to keep in mind as you're moving forward for adult mainstream. For Health Home Plus, we've talked about this as well a few times now. Got to go on and indicate that person is, and then you're going to have 12 months again in the annual comp assessment due date. So it's going to be done annually for Health Home Plus folks. And if it's a step down person, it's 12 months from the month that the person entered step down. If it's recommended continued services, it's every 6 months after that. If someone's diligent search and enrolled under a year, it's 12 months at the annual comp assessment due date. And then if it's continued recommendation, it's 6 months thereafter. If it's someone enrolled at over a year in their diligent search, it's 6 months after the month of re-engagement that you would complete it. If someone's pended, enrolled under a year, so it's going to be initial due date of 12 months at the annual comp assessment. If it's recommended continued services, it's 6 months thereafter. And then pended, enrolled over a year, it's either at the 6 months due date, if that has not passed, or if they missed the reassessment date due to being pended 30 days within the re-engagement in the program. So we're hopeful that this guide will help folks as a quick cheat sheet, if you will, or a reference when you're asking some of the questions that we've had today on this office hours. So just wanted to pause again to see if there was any questions or anything come through the chat, Hannah.
Nope, not yet.
Okay, thank you. So I'm going to turn it over to Taylor now. Taylor, can we hear you?
Hopefully, can you hear me?
Yes, we
Yes.
can.
Okay, cool.
All right, Taylor's going to just touch about some reports that we're looking at and working on. So thank you, Taylor.
Thanks, Travis. Hi, everybody. So we are working very diligently to get some reports and data done for you guys. We understand that this is a big undertaking and a lot of things to track. So there's a lot of moving targets, as you can see from what Travis presented, based on statuses and programs and all that good stuff. So, our hope is to make some reports that make it a little bit easier for you guys to have those dates similarly to like the comp assessment and the care plan, where it'll set forth dates based on logic. Obviously, it's a little bit more complicated with all the different pieces of it all, but we hope to have that in there for you guys so that you can see the upcoming dates for the CESS tool based on what the recommendation was on the last one, based on their statuses, based on their programs. So that being said, I just want to kind of harp on the importance of making sure that you guys are keeping up to date with programs and statuses. So especially that Health Home Plus step down program. I know we implemented that a while back. I don't think that there's that many people using it. So make sure that if you do have a member that's in step down, you have that program appropriately assigned to them. That way, when we do get these reports out, you're getting appropriate due dates for your CESS tool. And same goes for statuses when you're moving people out of DSE and things like that. Just make sure you're staying on top of that. And if they re-engage, you're putting them back into that enrolled status as soon as possible. That way, your CESS dates are up to date and current, and you can get the most accurate data once we get those reports ready for you guys. That being said, right now, I think I touched on it on the last office hours. There is a very bare bones report in there all the way at the end. It's not on the navigation page, but if you guys scroll all the way on the bottom to the very right, you'll see all of your CESS submissions. I have updated that to add in the recommendation that came out of the CESS tool. So for right now, that is available to you guys, and you can export it if need be into an Excel or a CSV. That way you guys can start to track your CESS tools that way. But hopefully in the very near future, we will have lots of fun logic built into that as well. But for the meantime, that data is available for you guys to start tracking your CESS tools.
All right, thank you, Taylor. I wanted to also just note that there's clearly, there was a delay in the policy coming out from the state, which was a delay in us getting the policy out. There's been a couple adjustments to the state FAQ document around the CESS tool. The last one just came out 2 days ago, which I will forward along with the slide deck and our policy once we're done with our meeting today. This is still a moving, changing thing. So all the answers may not be there at the moment. We're trying to do the best that we can to get the information to the network, and we'll continue to do so. But please, if you have questions, keep them coming. If we don't have the answer immediately, we'll definitely look into it and get back to you. There will likely be some touch points on this over the coming months through our future office hours as things continue to evolve, as people have more questions. We're going to put some time aside on office hours to make sure we're touching on it. And any questions that came up today that folks didn't feel that they got an answer on or have more questions on, please reach out. And we can do our best to get those answers to you as quickly as we can. Just didn't know if there was any other questions around the data piece or any thoughts people had before I went to the next step. Oh, Hannah, we good on the chat still?
Yep, no questions yet.
All right, thank you. And then the tool itself, are there any questions specific to completing the tool? I know we went over policy stuff and try to clarify some of that along the way, but are there anything that folks are still wondering about specific to filling the tool out that you wanted to ask or talk through today? Okay. With that, that's all we had today on the CESS tool. Hope this was helpful. Again, we'll have the recording up in the near future on the website, and we'll get this information out to everyone. And I really appreciate your time today. And as always, thank you for all you do. And I hope everybody has a real happy holiday season. Take care, everybody.
Bye, everybody. Thank you.